Hello, everyone. Today, we're diving into a topic that sparks curiosity and debate: controversial approaches to cancer treatment. While the majority of cancer treatments follow established medical guidelines, some alternative perspectives challenge the norm. We'll be exploring one such perspective, particularly associated with the work of Dr. Thomas Seyfried, a researcher known for his unconventional views on cancer metabolism. Dr. Thomas Seyfried, a biochemist, has gained attention for his work in cancer metabolism. He challenges the traditional understanding of cancer as a genetic disease, proposing that it is fundamentally a metabolic disease.
Just to realize this is a mitochondrial metabolic disease of energy metabolism, we will drop the death rate by more than 50% in 5 years. No question about it.
Instead of primarily focusing on genetic mutations,
The view that cancer is a genetic disease is largely responsible for maintaining death of people.
this perspective shifts attention to how cancer cells obtain and utilize energy. Cancer cells appear to have a heightened dependency on glucose for energy compared to normal cells. This reliance on glycolysis, even in oxygen-rich conditions, is considered a potential vulnerability that can be targeted for therapeutic purposes. Dr. Seyfried and others suggest that by altering the availability of glucose to cancer cells, we may impact their growth.
Guys, now, so this is what I'm saying. Metabolic therapy will get rid of a lot of things besides your cancer.
The ketogenic diet, which limits carbohydrate intake and promotes the use of ketones for energy, and intermittent fasting are explored as potential strategies to starve cancer cells. The diet is typically composed of high-fat sources, such as avocados, nuts, and oils, moderate protein intake, and very low carbohydrates, restricting sugar, bread, pasta, and some vegetables.
The more we are into the Western diet and lifestyle with highly processed carbohydrate foods and reduced exercise, the more at risk we're going to be for cancer and all the other chronic diseases. But cancer is the one that people most fear. I think it puts a fear of God into people.
Beyond cancer, the ketogenic diet has been studied for its potential benefits in epilepsy, neurodegenerative diseases, and metabolic disorders.
Once the body is in ketosis, chemotherapies can be reduced massively in their dosages and still have good therapeutic benefit.
Intermittent fasting involves cycling between periods of eating and fasting. Common methods include the 16/8 method, 16 hours of fasting with an 8-hour eating window, and the 5-2 method, eating normally for 5 days and significantly reducing calories for 2 non-consecutive days. Fasting triggers a cellular process called autophagy, where the body cleans out damaged cells and regenerates new, healthy ones. This process is believed to have potential benefits for overall health and may play a role in cancer prevention. Some studies suggest that intermittent fasting may influence cancer risk by reducing inflammation, improving insulin sensitivity, and promoting cellular repair. Both the ketogenic diet and fasting have generated interest for their potential roles in metabolic health and cancer prevention.
80% of cancers can be prevented.
However, it's important to approach these practices with caution and consult with healthcare professionals. Our journey today underscores the importance of embracing a comprehensive approach to cancer research and treatment. Recognizing the genetic mutations that drive cancer allows us to target specific vulnerabilities. Simultaneously, acknowledging the metabolic alterations opens avenues for exploring interventions like the ketogenic diet and fasting. In this nuanced narrative, it becomes evident that the future of cancer understanding lies in integrating both genetic and metabolic perspectives. As researchers continue to unravel the mysteries within our cells, collaborations between geneticists, biochemists, and clinicians will pave the way for more effective and personalized approaches to cancer prevention and treatment. In closing, let's navigate the evolving landscape of cancer research with an open mind. As we bridge the gap between genes and metabolism, we inch closer to a future where our understanding of cancer is as intricate and dynamic as the disease itself. Thank you for joining me on this exploration, and may our collective knowledge illuminate the path towards breakthroughs in cancer science. See you next time.